High blood pressure or hypertension as of today remains inadequately controlled in India as large numbers of cases go undetected. It is estimated that the number of patients in India with high blood pressure is likely to rise from about 140 million in 2008 to nearly 215 million by 2030. It's not an old man's disease anymore. More and more young people are suffering from high blood pressure related ailments. So let's find out what people know about this condition.
When was the last time you checked your blood pressure?
About a month ago.
What was it?
Around 110.
What is the normal blood pressure range?
I guess it's 120 by 80.
What causes high blood pressure?
No clue.
How can you control your blood pressure?
By regular exercise and reduce the intake of salt.
When was the last time you checked your blood pressure?
I don't think I went and checked it, but I think there was some surgical procedure that I had to undergo last year, so they had checked it for me, but I didn't check the figures or anything.
So do you know what was it?
I think it was normal from what they said, but I don't know what it was.
What is the normal blood pressure range?
I think it's some 120 by 80 or something like that.
What causes high blood pressure?
High blood pressure, I think, if I'm not wrong, excessive intake of salt, cigarette smoking.
And how can you control it?
By exercising and keeping yourself active, regulating your salt intake, and of course not smoking.
When was the last time you checked your blood pressure?
A really long time ago, I'm not sure.
Why?
I know, just part of a medical procedure.
Do you know what was it?
No, I'm not sure.
What is the normal blood pressure range?
I think it's 120 by 80, I guess.
What causes high blood pressure?
I think it's a really stressed out way of living that possibly pushes the blood pressure. I think.
That's it.
Yeah.
And what are the means to control it?
I think exercise would be one.
आपने आपका ब्लड प्रेशर लास्ट टाइम कभी चेक किया था?
मैंने एक भी बार नहीं कराया.
अब तक नहीं करा?
नहीं, एक भी बार नहीं.
आपके हिसाब से नॉर्मल ब्लड प्रेशर का रेंज क्या होता है?
120 by 80.
हाई ब्लड प्रेशर क्यों होता है?
कोलेस्ट्रॉल के जैसे कोलेस्ट्रॉल बढ़ जाता है तो
हाई
ब्लड प्रेशर.
इनको हाई ब्लड प्रेशर को रोक कैसे सकते हैं?
या तो फूड के बाय फूड थ्रू और अच्छा खाना से और एक्सरसाइज.
हेल्दी फूड और एक्सरसाइज. आपने आपका बीबी लास्ट टाइम कभी चेक किया था?
2 months back.
कितना था?
Around 160.
नॉर्मल बीपी रेंज कहाँ से कहाँ तक होता है?
110.
हाई ब्लड प्रेशर क्यों होता है?
Because of tension और हेल्थ वेट जो भी बढ़ जाता है उसकी वजह से.
और इनको अवॉइड कैसे कर सकते हैं?
योगा और वॉकिंग.
स्ट्रेस फ्री एनवायरनमेंट. आपने आपका बीबी लास्ट टाइम कभी चेक किया था?
2 months back.
कितना था?
Around 160.
नॉर्मल बीपी रेंज कहाँ से कहाँ तक होता है?
110.
हाई ब्लड प्रेशर क्यों होता है?
Because of tension और हेल्थ वेट जो भी बढ़ जाता है उसकी वजह से.
आपने आपका बीपी लास्ट टाइम कभी चेक किया था?
मैंने इससे पहले लास्ट बार शायद एक साल पहले चेक किया था. तब
क्या था रेंज?
somewhat around 125.
नॉर्मल बीपी रेंज कहाँ से कहाँ तक होता है?
I believe is 120. Yeah.
And how can you avoid high blood pressure?
Like without tension, right? Having a proper nutritious food, like that only. Like having a good healthy life.
And what causes high blood pressure?
More tension, stress, and eating a junk foods.
आपने आपका ब्लड प्रेशर लास्ट टाइम कभी चेक किया था?
6 महीने पहले.
कितना था?
110 और 70.
नॉर्मल ब्लड प्रेशर का रेंज क्या होता है?
इट्स अबाउट 120 और 80
के बीच में.
या इसके बीच में.
हाई ब्लड प्रेशर क्यों होता है?
स्ट्रेस लेने से, टेंशन, डिप्रेशन, ये सब की वजह से हो सकता है.
हाई ब्लड प्रेशर
या हाई टेंशन, बहुत सारे टेंशन लेने से हो सकता है.
और इनको रोकने के तरीके क्या है?
हेल्दी फूड खाओ, एक्सरसाइज करो और जिम शिम करो, अच्छा हो जाएगा.
So there you have it. Not many people are aware of what hypertension is exactly or how it can be controlled. To set the record straight, here are the most common questions about hypertension answered. Blood pressure or BP is one of the most important signs of life. It is the pressure exerted by circulating blood upon the walls of the vessels and is expressed as systolic or diastolic blood pressure. Systolic refers to blood pressure when the heart beats while pumping blood, and diastolic refers to blood pressure when the heart is at rest between beats. The range of systolic blood pressure for most healthy adults is between 90 and 120 mmHg. Normal diastolic blood pressure ranges between 60 and 80 mmHg. Blood pressure doesn't stay the same all the time. It lowers as you sleep and rises when you wake up. Blood pressure also rises when you're nervous, excited, or active. What is hypertension or high blood pressure? If your blood pressure is lower than 120 or 80 mmHg most of the time, it is considered normal blood pressure. Pre-hypertension is a condition when your blood pressure ranges between 124 to 140 systolic and 80 to 90 diastolic. In the case of hypertension, on the other hand, your blood pressure will be constantly higher than 140 or 90. There are four main types of hypertension. They are primary hypertension, secondary hypertension, isolated hypertension, and malignant hypertension. What causes high blood pressure? Blood pressure usually rises with age because your blood vessels become stiffer. But hypertension can strike at a younger age, and the main reasons for hypertension are environmental factors, family history of high blood pressure, obesity, stress, smoking, excess alcohol consumption, increased salt consumption, and diabetes. We asked Dr. Vijay Surase why you should take hypertension more seriously. Here is what he had to say.
See, hypertension is a silent killing disorder. It silently approaches towards the end organ disorders which cannot be treated ultimately.
What are the signs and symptoms of high blood pressure? There are no symptoms most of the time. You may find out that you are hypertensive at a routine health examination. Malignant hypertension, a severe and dangerous form of high blood pressure, has symptoms such as severe headache, nausea or vomiting, bad headache, confusion, anxiety, sleepiness, changes in your vision, chest pain, weakness or numbness of the body, bleeding from the nose, swelling in the legs and feet, abnormal heart sounds, fluid in the lungs, changes in reflexes. How is hypertension diagnosed, and what are the tests involved? Normally, the blood pressure varies throughout the day. Hence, a single reading of high blood pressure is not the basis for diagnosing hypertension. If you have a persistently high blood pressure reading, you will be diagnosed as having hypertension. Your blood pressure is measured using an instrument called the sphygmomanometer. It has an inflatable cuff to wrap around your arm and a mercury or mechanical manometer to measure the pressure. Other clinical examinations will include an eye examination to look for signs of damage to the retina, and in some cases your kidney function will also be tested. What is the treatment for hypertension? The aim of treatment will be to lower the risk of damage to the organs of the body by keeping your blood pressure within the normal range. If you have been diagnosed with pre-hypertension, you will be advised to make dietary and lifestyle changes, a healthy diet, decrease salt intake, regular exercise, quit smoking, reduce stress, etc. If you are obese or overweight, you need to lose those extra kilos. If these changes are ineffective in controlling your increased blood pressure, you will be prescribed medicines to lower your blood pressure. Here are the tips from our expert Dr. Vijay Surase on how to handle hypertension.
Now people don't have symptoms, that's why they neglect hypertension. They don't have symptoms related to high blood pressure. When they come in with high blood pressure, maybe around 170-100, they might feel absolutely okay. There might be incidental headache or incidental fever which requires treatment, and once that is treated, they neglect their baseline hypertension. But we need to tell them this hypertension slowly over a period of 5, 10 years or 20 years maybe will affect their kidney, will affect the brain, heart and retina. Same way, this management of the hypertension gives you coverage for the risk towards the stroke, heart attack, kidney failure and retinal blindness. Now if you control blood pressure, what you are going to achieve? You are going to save your kidney from getting transplant, maybe before the dialysis. You are going to save your kidney from kidney failure. If you are going to control your blood pressure in the physiological range with the medications, with lifestyle, you are going to save your heart from heart attack. You are going to save your brain from stroke, cerebrovascular accident.
Other clinical examinations will include an eye examination to look for signs of damage to the retina, and in some cases your kidney function will also be tested. What is the treatment for hypertension? The aim of treatment will be to lower the risk of damage to the organs of the body by keeping your blood pressure within the normal range. If you have been diagnosed with pre-hypertension, you will be advised to make dietary and lifestyle changes, a healthy diet, decrease salt intake, regular exercise, quit smoking, reduce stress, etc. If you are obese or overweight, you need to lose those extra kilos. If these changes are ineffective in controlling your increased blood pressure, you will be prescribed medicines to lower your blood pressure. Here are the tips from our expert Dr. Vijay Surase on how to handle hypertension. What happens if you are not treated for high blood pressure? Long-standing hypertension can cause problems with your vision, also called as hypertensive retinopathy, and decrease blood supply to your legs. Hypertension is a major risk factor for heart attacks, heart failure, stroke, bleeding from large blood vessels, that's aortic aneurysm, chronic kidney disease, also called hypertensive nephropathy. Apart from all the treatment options, you could try reversing hypertension. A pioneer in the field, we asked Dr. Namrita Shah on how hypertension can be reversed.
Well, actually many lifestyle diseases can be reversed, but the most common diseases we see today are heart disease and hypertension, diabetes, which are common lifestyle diseases, obesity. But this can also, basically it's about eating the way nature or God intended us to eat. And I can only liken it to a car. If you have a car, you will fill it with the best quality of petrol so that it will run really smoothly. Now, in a petrol car, if one day you see no petrol and you put in diesel, will it run well? The reason it doesn't run well is because that's not the fuel intended for that car. It's the same with a lion. If you give a lion grass, he won't do well. If you give a horse meat, she won't do well. If we understand the right fuel for our body, it's almost impossible to get diseases.